Title IX of the Education Amendments Act states, "No person in the United States shall, on the basis of sex, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any education program or activity receiving federal financial assistance." This applied to all education institutions, public and private, meaning women can have equality within the education system as well as sports. The National Coalition for Women and Girls in Education had reported only 295,000 girls participated in varsity athletics in 1971. In 2001, that number skyrocketed to 2.8 million, or 41.5% of all varsity athletes. With this growing number of women in sports, injury rates raised right along with it, more specifically ACL tears. Your ACL, or anterior cruciate ligament, is located between the tibia and the femur. This ligament connects both bones along with other tendons in our knee. This isn't just a nightmare for the female athlete, but for her family's insurance as well. Insurance companies pay about $50,000 for ACL reconstructive surgeries. That doesn't include the cost of the MRI and the X-ray testing fees done to correctly diagnose the patient with an ACL tear. With an estimated 200,000 ACL cases a year, and about 100,000 of them undergoing reconstructive surgery, this means insurance companies pay roughly $5 billion annually. 70% of these cases were sports-related, and female athletes make up the majority of that percentage. Most of the female athlete cases are girls in high school, ages ranging from 14 to 18. ACL reconstructions consist of the removal of the already torn ACL with a new piece of another ligament or muscle getting screwed into its place. The new ACL is either from a cadaver, a piece of the patient's hamstring, or a piece of their patella tendon. In choosing the patella tendon, for example, the middle section of the patella is removed and the remaining pieces are sewn together. The actual reconstruction itself is orthoscopic, meaning that 2 incisions are made and a small camera is inserted so that the orthopedist can see what he or she is doing and so that there is minimal scarring left behind. Yet, the athlete in doing this does waive the right to feel correctly on one side of her knee. With the removal of the patella, a nerve is cut to access the tendon, and since nerves do not regenerate, the athlete is left with a numbing yet sensitive sensation that they must live with for the rest of their life. University of Miami's Dr. Leonard Bullard from the Department of Orthopedics and Rehabilitation had discovered that between the years 1994 and 2006, there had been an increase by 177% in the sex-adjusted rate of women undergoing ACL reconstruction. But why are women tearing their ACLs more than their male counterparts performing the same sports at the same level of play? A major discovery that goes to answer this is that women don't fully develop neuromuscular health, causing an imbalance where females favor one part of the body over another. The 4 main compensating body parts that women choose to overuse due to their imbalances are dependencies on the quads, the core, the ligament, and the leg. Evidence of this imbalance can be found in how women move during play in agility sports. For example, women tend to land on their jump more erect than males, causing the need to take more impact rather than the absorption of it. Prevention programs have been set in place to try and re-educate the muscles to react and move in a way that not only gets the players to perform better for their sport, but better for their body.